Press Show.
So, Fran, welcome to Washington. Good to have you in our nation's capital.
Thanks, Bill. Happy to be here. Always good to talk to you.
I have to tell you, going back to Jane Fonda, a real good friend of mine, and we started out in Los Angeles together, and, she was always attacked, right, for being an actress and a celebrity and yet active in political issues. And I'm sure you've had those kinds of attacks. What do you say to people when they say that you should just stick to your acting?
I don't know why you make that assumption, because I really don't get those kinds of attacks.
Really?
To tell you the truth.
Good for you.
I think I'm a little more middle of the road than Jane was.
Yeah.
And I think that I come across in a way that what you see is what you get, and I'm kind of very authentic and trusting, and I think that the public has come to know that I'm a person of word and deed, and I come from a very humble background and went through public school system, and I'm just a woman that grew up in Queens. My dad worked 2 jobs when I was growing up, and I was very lucky to become famous, but then I feel like as a cancer survivor, the thing that helps make sense to me is that I got famous, I got cancer, and I lived to talk about it. So I've sort of dedicated my life to changing healthcare in this country from back-end healthcare, which is late-stage diagnosis, and trying to keep people alive who are chronically ill, to front-end healthcare, which is putting the focus and the money on prevention and early detection.
Right.
And that's actually what countries that have nationalized healthcare do, because basically that's less expensive on the taxpayers. But the reason why we lose so many loved ones to cancer is really more because of late-stage diagnosis, and that really is no incentive from big business health companies that are publicly owned to cure us at the early stages.
Right.
If you were beholden to shareholders and you can make $7,500 on a surgical procedure versus $750 on an in-office procedure, what would you do on behalf of your shareholders? And that's what we, the people, are being victimized by right now, and that's why Cancer Schmancer is being so front and center about flipping the switch on that, and also encouraging people to be wary of naysayers when it comes to the healthcare option, because just like it's not to replace privatized healthcare, but just like you may use FedEx or you may use UPS, but I would not want to be beholden to them if I didn't have U.S. mail to keep them in check.
Right.
And that's basically what it's going to be. It's an option that some people will opt for and other people won't. And, in this country, if my house goes on fire, I want to know that I have a fireman to come and put the fire out. And if I get in trouble with the law, I want to be guaranteed an attorney. And if I have a child, I want to know that kid's entitled to an education and is not going to be illiterate. And if I am sick, I want to know that I'm going to have a freaking doctor. Period.
Right.
End.
Yeah. Well, you come to this healthcare debate obviously with your own credentials and your own experience. I mean, nobody can deny that. Do you think that the ideal solution would be so-called single payer, like they have, in England or France or Canada?
No. I think it's what President Obama is proposing,
which is an healthcare
option
with a strong public option, huh?
Yes,
yeah.
Yes, absolutely. Just like anything else, public schools, and there's no. First of all, what people don't realize is the burden that is put on taxpayers right now to take care of people that are very sick with no health insurance. And if there was some kind of a program,
we're paying for them. Really.
We're totally paying for them anyway. Yeah. It might as well be structured and shifted in a way that we present it as a prevention and early detection. And I believe that only some kind of a nationalized health care program put in place will make that shift. You cannot force big business that is kind of exemplifying capitalism run amok to do right by people. It doesn't work that way, and we see that with the recent, economic collapse. That was all, people at very high levels that were very, very greedy, that never think about...
In it for themselves.
Exactly.
Totally.
And they do what they have a right to do. No one actually broke the law, but nobody did what was the right thing to do. I live by the golden rule. I try and do what's the right thing to do. And the right thing here is to, help people reduce the excess spending on trying to take care of people that are so sick, and keeping these public companies that are in the healthcare business in check, because there is another option.
Now, you have been working the Hill. You've been here in Washington. You've been talking to people. Do you think we're going to get healthcare reform legislation this year? What's your sense?
I really don't know. I hope so, but you know what enters into it? Bipartisan egos. And once you, not bipartisan egos, partisan egos, I should say. I wish it was bipartisan. But the partisanship that goes on Capitol Hill is maddening. And therein lies the rub. And so at the end of the day, if I can get the people who ultimately have the power to make their feelings known. If there are enough people that agree with me, because I'm an everyman just like the rest of them, I just call it as I see it. And I have no hidden agenda here. So, if everybody called their elected officials, no matter what side of the party line they're on, I'm going to say this. I've met a lot of elected officials, and I've never met one that didn't want to get reaelected. And even right. 25 calls in a single day will have anybody on either extreme of the party line wake up and smell the coffee and say, you know what, this is not a Republican or Democratic issue. This is a human issue for Americans. And, stop.
Yeah.
Let go of all the miscommunication, because at the end of that, it really has to do with ego.
Amen to that. Now, before we let you go, I want to ask, how can people keep in touch with you, find out what you're doing? Cancer Schmancer, is that the way?
CancerSchmancer.org is a great way to get in touch with me, and I do get the mail that people write to me through Cancer Schmancer, but I would appreciate it if people would sign up and become an active member, and even make a donation if you are in the mood to be generous, because we're doing amazing things, and I think that we almost stand alone on the projects and positions that we take, and we're aggressive and want to really see a change. And but I need to have an army behind me to march on Capitol Hill and say, look at all these people that feel the same way that I do. So, get your act together, boys, and let's do what's right for the people.
CancerSchmancer.org. I tell you what else, Fran, we'll put a link up on our website so we can help you out, encourage our listeners to join you as well. And thank you for your time this morning, and also thank you most of all for your leadership on this issue. Nothing more important.
Thank you. I appreciate you giving me the time, Bill, and you be well, and I hope all your listeners have good health. And if you are, by any chance, going through something, that's another reason to go on to CancerSchmancer.org.
The Bill Press Show. Want to hear more? Get the full podcast of the show every day when you join the Bill Press Club here at BillPressShow.com.